Good morning. I'd like to welcome everyone to the 2024 annual benefits meeting. This morning we have presentations from Penn State Human Resources and from Highmark Blue Cross. I'm sure you will get a lot of information from their presentations. Before we start with that, I would like to add one thing about the association. We did get the results of our election on changing the term limits for the president-elect, president, and past president to 1 year. So I'm hoping with that we will get a person to volunteer for president-elect. With that done, I'd like to turn the meeting over to Tonia Rudy for presentation from Human Resources. Tonia?
Morning, and thank you for inviting Penn State Employee Benefits and Highmark to your Retiree Association meeting to discuss retiree coverage for your plan year 2025. Some housekeeping items before beginning today's webinar. We understand that you may have specific questions that are related to your medical care or prescription benefits, but this webinar platform is not the best avenue to address those due to their confidential nature. If you do have questions, though, please, we invite you to type into the chat. In case your question is not addressed today during the webinar, please include your full name and email address for follow-up. Now for a round of introductions from Penn State and Highmark. To get things started, my name is Tonia Rudy, the Retiree Benefits Specialist. Kelly Bartley-Weber is joining us from Highmark, and she will share information on your pre-65 retiree medical plan, Line Advantage, and Line Traditional. We also have Tyler Quinn from Highmark presenting from Freedom Blue PPO Medicare Advantage plan information. Thank you all. Thank you to all our Highmark guests for joining today as well. Let's start with some Penn State related details and then move into the Highmark information. You're good. Retiree medical plan billing continues to be administered by Lifetime Benefit Solutions into 2025, with no changes to the terms or process that LBS follows. You will be billed on a quarterly basis with payment due the first day of each quarter. You do have a 60-day grace period the day after payment is due, with a variety of payment options available to satisfy your bill. The easiest way to check on the status of your bill and or payment information is to access LBS member portal or by contacting LBS directly at 1-855-798-0683. The non-Medicare retiree plans will experience an increase in contribution rates from 2024 into 2025. As in prior years, these rates, as well as some of the more common rate combinations, can be located on the retiree benefit website maintained by Penn State Employee Benefits. For any retiree that will be turning 65 in 2025, here are some important reminders as you approach Medicare eligibility. Starting 2 to 3 months prior to the month that you turn age 65, please visit your local Social Security office to begin the Medicare Parts A and B enrollment process. You do not want to enroll in Medicare Part D for prescription coverage because Penn State's Retiree Freedom Blue PPO plan has coverage for your prescription drugs. While you will send a copy of your Freedom Blue application, you can also obtain a copy from the Penn State Retiree website if needed. Once you receive your red, white, and blue Medicare card, you will need to complete your Freedom Blue application and submit it to the Employee Benefits Office. That can be done most efficiently by emailing the benefits team at benefits@psu.edu. You are also able to send by mail, fax, or you can drop it off at our office. Remember, the Penn State has a varied split plan of ability to ensure coverage for retirees and their dependents based on age and the eligibility for Medicare. Presented here are some of the most common groupings of coverage. First, the retiree is age 65 and moves to Freedom Blue plan. The spouse is under age 65, remaining on the retiree Lion Traditional or Lion Advantage plan as a primary subscriber with any children as dependents under the spouse. Second, the retiree age 65 and moves to Freedom Blue plan with no spouse, but has children covered. The oldest child covered will become the primary subscriber on the retiree Lion Traditional or Lion Advantage plan, with any additional children as dependents under the oldest child as the primary subscriber. Lastly, the retiree is still under the age of 65, and the spouse who turns 65 and has covered children. The retiree will remain the primary subscriber on the retiree Lion Traditional or Lion Advantage plan, with children as dependents on their plan. The spouse will move to their own Freedom Blue plan. As a reminder, you will have children, if you have children over the age 26 who are disabled, also enrolled under your plan, given one of these options. In this case, your dependent child can also be enrolled in Freedom Blue if they are enrolled in Medicare A and B. Once you're retired, you will no longer have access to your employer-sponsored dental and vision options. But you do have other options available. The Pennsylvania Association of Retired State Employees, called PARS, offers additional benefits to Penn State retirees after their COBRA offer ends. As these benefits are not administered or associated with Penn State employee benefits, you will need to contact their office directly to find out more details regarding enrollment and cost. Additionally, IMED offers a retiree discount program to all Penn State retirees. If you visit an in-network participating provider, you can receive a discounted rate on vision services. And don't forget that if you still have a spouse actively employed at Penn State, you are able to participate as a dependent on the active dental and vision plan so long as they retain coverage. If your actively employed spouse wants to add you to their dental and or vision coverage, they should do so in Workday during the annual benefits open enrollment period. Lastly, a reminder regarding Able Pay, which is a way to help reduce your medical bill costs. This is a program available to all retirees. Enrollment is direct with Able Pay, and once you are enrolled, you will find that they offer flexibility in payment options, convenience of online payment, they help answer member billing questions, as well as an opportunity to save on the overall costs of your bill. Payment terms and savings examples presented here shows that savings possible are between 5 and 13%, depending on the payment method. There are no interest applied on the bill when applying for Able Pay payment terms. As there is no enrollment required through Penn State, we do recommend Sorry about that. I'm sorry about that. Okay. To close out the information that Penn State Employee Benefits is sharing with you today, here is a snapshot of your retiree benefit resources, including vendor contact information, HR services, and the retiree website information. For medical claim or coverage questions, please be sure to call the appropriate Highmark plan. I am now going to turn things over to Kelly to share the pre-65 retiree medical and prescription coverage details.
Hi, Tonia. Thank you so much. Thank you, everyone, for joining us today. I'm going to go ahead and review the non-65 retiree medical plan options provided by Highmark. So, Tonia, if you want to go to the next slide. First, I want to go ahead and let folks know that you are going to be continuing with Highmark for 2025. There will not be any plan design changes for 2025. We're going to review the deductibles, coinsurance, and co-payments for 2025 on the next slide. I do want to mention that there is a slight increase on the Lion Advantage, and this is due to IRS regulations. Your prescription, coinsurance, and out-of-pocket maximums will remain the same for 2025, and you will continue to have one ID card for both medical and prescription. You can expect new ID cards that should be arriving approximately the third week of December. And with Highmark, you can continue to expect and rely on your national network of providers. We have access to 1.8 providers nationwide and 97% of the hospitals. Your preventive services, as long as you are following that preventive care schedule, will be continued to be covered at 100%. And anytime you do experience emergency, please know that that will be covered at an in-network level, regardless of where you are in the country. And Tonia, if you want to go to the next slide. So just a high-level comparison between the two non-65 retiree options that you have. You have the Lion traditional plan. This is where you have a $375 individual deductible and a $750 family deductible. On this plan, your deductible does apply to those high-ticket items, things like labs, x-rays, in- and outpatient services, and durable medical equipment. You do want to keep in mind that your office visit copays will not apply to the deductible, and nor does your prescription coinsurance apply to the deductible. So again, you're going to have your deductible expenses. Once you satisfy your deductible, you will be responsible for 10% of those deductible defined expenses, those in- and outpatient services, labs, tests, and x-rays. When seeking services from your primary care physician, you'll have a $20 copay and a $30 copay when seeing a specialist. We're going to review the prescription coverage in another slide, so I'll hold off on that one. Your Lion Advantage plan this year, this is the plan that if you are enrolled in the Lion Advantage, you have a $1,650 individual deductible. Again, this was increased slightly from $1,600, and that is an IRS regulation, and that's why that change went into effect. So as an individual, your deductible is $1,650. As a family, it is $3,300. Keeping in mind that a family is you plus one other person. So you plus a spouse, you plus a child, or you plus that spouse and children. The entire family must meet that $3,300 before the family moves into the coinsurance level. So that $3,300 could be met by one person or a combination of all of you. Until you are age 65 and enrolled in Medicare, you do still have the option to contribute to your health savings account. But please remember at this time, as retirees, there is no longer an annual seed funding that will go into that account. Tonia, if you want to go to the next slide. If you are enrolled in the Lion traditional plan, you will continue to have access to the Condition Care Program. The Condition Care Program is a way to reduce costs for some frequently used services if you have diabetes, high blood pressure, or high cholesterol. This is really aimed at eliminating any cost barriers So any fees that you have for office visits or required lab work or diabetic supplies would be covered at 100%. There is no enrollment necessary in this program. If you are enrolled in the Lion Traditional Plan and a claim gets submitted for an office visit related to diabetes or high blood pressure, this is going to automatically kick in and pay at that higher level. Please remember that the Lion Traditional Plan is the only one that comes with the condition care program. Excuse me, Tonia, if you want to go to the next slide. Let's go ahead and review how you can get your prescriptions. You have the ability to obtain your prescriptions at a retail pharmacy for a 31-day supply or use mail order for a 90-day supply. If you are enrolled in the Lion Advantage plan, you do need to satisfy your deductible first, that $1,650 or that $3,300. Once you satisfy your deductible, you will pay 10% for generics, 20% for preferred, and 40% for non-preferred. You have the ability to use mail order. You're going to see the same coinsurance level, so it's going to be 10, 20, or 40% based on the tier of your drug, but you do get that added convenience of having those prescriptions delivered to your home. If you are taking a prescription that is on the preventive drug list, this is a list that is kind of outlined by the IRS. It allows you to skip your deductible and go straight to that 10, 20, or 40% cost share. If you're enrolled in the Lion Traditional Plan, you will pay 50% for generics and 50% for preferred or 70% for non-preferred until you hit $2,000 per person. Here with mail order, you do get some cost savings. You would see that you're going to pay 20% for a 90-day supply versus 50% for generics and preferred. And again, you get that added convenience of having those prescriptions delivered straight to your home. With the Lion Traditional Plan, that preventive drug list can apply as well. And you do see a lower coinsurance, so 10, 20, or 40% versus the 50% or 70%. So again, you still get that added savings on that preventive drug list on the Lion Traditional Plan as well. Tonia, if you want to go to the next slide. Both of your plans have lab work that is applied to your deductible. And again, the deductible is that amount of money that you, the member, are responsible to pay before your plan kicks in. And so whether you are in the deductible part of your plan or the coinsurance part of your plan, you will see a cost savings when you see a standalone facility such as Quest or LabCorp. And the reason being, they are open 8 to 5. It's a standalone facility. They are not connected with a hospital that has 24-hour services, that staffing, the equipment. And so they're able to charge a lower amount. So again, if you're in the deductible part of your plan, you're going to reap that benefit and pay a lower amount. If you've satisfied your deductible, this is where you're going to see your lowest amount of cost share using Quest, LabCorp. You'll only pay 10% after your deductible, 30% with another in-network lab or hospital-based lab, and 50% for an out-of-network lab. Tonia, if you want to go to the next slide. I just want to remind some folks about the services you do get through Highmark. So if we go to the next slide, we're going to first review your My Highmark app. Your My Highmark app really is your one-stop shop for managing your benefits. It is where you can access a virtual ID card. Super helpful because we all carry our smartphones these days. Maybe we forget our purse or our wallet, but again, having that smartphone is always pretty accessible. So it's a great way to have access to your ID information. Additionally, you can log in, and instead of trying to see your member ID number on those small little cards, I know myself, even in my mid-40s, I start to have a difficult time seeing those numbers. Those numbers are actually a little bit more expanded, and you can see them much easier when it's in your phone and on the app. So great way to get that information. But you also get to manage your cost. You can do some cost comparisons, view your claims, and see where you are in meeting your deductible. Additionally, if you want to do some further exploring, there are some programs that are available. We really want to help our members make sure they're living their healthiest lives. You can do things like increase your hydration, and it's an interactive kind of experience where they send you some push notifications. You can increase your lower body activity. You can also do things like managing some mental health. So it really is a great way to engage with your health. It gives you all the basics that you need, but lets you engage at whatever level you'd like to. Tonia, if you'd like to go to the next slide. A reminder about some of the additional programs we have. We have the Blue 365 deals. These are the discounts you get just by being a Highmark member. You get discounts on some home and family items, some fitness things like yoga mats and earbuds, travel, rental car discounts. So again, be sure to check out our Blue 365 deals to see all the discounts that you're eligible for, anything from 10 to 30% off the regular price. We have a diabetes prevention program. This is a 52-week program that's going to teach you some healthier lifestyle choices that reduces your risk for full onset diabetes. And we do have some disease management programs. So if you have conditions like asthma, diabetes, or heart disease, you can get some one-on-one coaching with a nurse support to help manage those conditions. As a Highmark member, you also have access to a free identity theft service through Experian. You do need to enroll to be eligible for this program. You can visit www.experianidworks.com/Highmark. And if you log in prior to 12/1, you're going to use the code Highmark24. If you log in to register after December 1st, you want to use Highmark25. But that is going to sign you up for those free identity theft services through Experian. And I'm going to wrap up with just my last slide. Those here are all listed. The ones in the green, you can all access through your My Highmark platform, whether it's the desktop, myhighmark.com, or your phone app. You can access all of those benefits. The ones listed here, you can access by calling the number on the back of your ID card. We have wellness coaches if you're looking to maybe lose weight, reduce your stress, learn to sleep a little bit better. We've got case managers and behavioral health specialists, some social workers that will maybe put you in touch with the right community resources, and you still have access to that 24-hour nurse hotline if you have generic medical questions and want to get those answered. Again, these are all accessible just by calling that number in the back of your ID card. And from there, I'm going to wrap up. I am going to turn it back over to Tonia, who's going to reintroduce Tyler. Unless, I don't know, Amanda, did you want to do any questions, or I'll just stay on a little bit longer and see if there are any questions that come in for the non-65 folks.
Thanks, Kelly, for bringing us to the end for those that are non-Medicare eligible. I have been answering questions within the chat, so nothing specific regarding those non-Medicare retirees. But with that said, we'll turn it over to Tyler to take it away on the Freedom Blue plan.
Okay, thank you. Have a great day, everyone.
Thank you.
Thank you.
Okay, I'm going to go ahead and take the screen share here. Just 1 second. Okay, can everybody see my screen? Clif, I saw a nod. It sounds like I'm good. You seeing my screen? Okay. All right. So hello, everyone. My name is Tyler Quinn. I'm the client manager for the Medicare Advantage Plan Freedom Blue PPO through Penn State. We are going to talk about a number of items today, just a general, very high-level overview of Medicare Advantage plans. We're going to talk about provider network and coverage briefly. I did already see a question about provider network. That's a hot topic these days, so hopefully we'll be able to address that and answer questions. We are going to talk about the medical benefits and the drug coverage. There are some changes this year, so we're going to dive into those. But before we get to it, it's more good than bad. I know no one likes change, but bear with me. We'll get through it and we'll talk through the changes and answer questions about that. After we talk about the benefits, I'm also going to have FitOn, who is our new fitness vendor for 2025. They will be presenting some slides on FitOn, and they will be replacing silver sneakers for 2025. We also have the Highmark House Call program. They joined us last year. They will be joining again this year, presented by Matrix Medical, the Matrix Medical team. So Medicare Advantage plans, this is just a general overview, real quick to kick us off here. Medicare Advantage, sometimes called Medicare Part C or MA plans. Medicare Advantage is offered by private companies that must follow rules set by Medicare. Medicare Advantage plans are required to cover the same benefits that are offered through original Medicare Parts A and B, but members are required to remain enrolled in Medicare Part A and B. If for any reason you were to lose your Medicare Part B, whether that be from not paying the premium or otherwise, you would be automatically disenrolled from your Medicare Advantage plan via Medicare. So you want to make sure you continue to pay that Part B premium and remain eligible with Medicare to keep enrolled in your Medicare Advantage plan. If you are, for any reason, looking into other coverage, that question comes up every year. You want to know that all plans are not created the same. Some plans may or may not include prescription drug coverage, and plan designs can vary. Deductibles, copays, coinsurance. Some plans are designed with narrower networks than others. So these questions come up annually and all the time regarding other options. So if for any reason you are looking into other plans, you want to make sure that you're doing a side-by-side comparison of the benefits, of the networks, and of the formularies, of course, to make sure your drugs are covered as well. Penn State, as we're going to cover here later, has a very rich plan design, a very robust network, access to the Blue Cross and Blue Shield Association across the nation, and a very robust formulary covering a number of drugs that may not be on other plans' formularies. So we'll get into that in more detail here as we go. So as I was saying, Highmark is part of a network that's been providing secure and stable healthcare coverage for over 90 years. 1 in 3 Americans are covered by that same network today. So when you're with Highmark, you're in good company. My only cheesy slide of the deck, so sorry. Medicare Stars ratings. Every Medicare Advantage plan receives between 1 and 5 stars to show how well their plan performs. Stars are determined by several factors, which include helping members stay healthy, managing chronic conditions, ensuring positive member experiences, achieving member satisfaction, and providing effective customer service. So out of 5 stars, Freedom Blue PPO has 4.5 stars. If you're ever curious about comparing plans, you can go right to cms.gov, and that will tell you exactly how plans are, stack up against each other. 4.5 stars. We're very pleased with that rating. Okay, so now we can get into the provider network. I know there was a question in the chat that I'll speak to here, but as I was saying, we do have a robust provider network. You're covered locally. Our plans are accepted at most hospitals and medical practices locally. Nationally, you do have the flexibility of the national network of in-network providers with the Medicare Advantage Network Sharing Program that links all the Blue Cross and/or Blue Shield plans across the nation. Worldwide, this question comes up from time to time. Your plan does provide you with emergency and urgent care worldwide if you are traveling outside of the country. So you shouldn't hesitate to go and get emergent or urgent care if you need it. The only catch with that is providers in other countries may not be able to submit claims back to the insurance. There is a very good possibility that you may have to pay out of pocket for services received when you're traveling abroad. You want to make sure that you get an itemized receipt. It would be helpful if that receipt was in English, but if it's not, that's okay. Make sure you're getting an itemized receipt for everything that you're paying for, and bring it back and send it in to us so that we can get that reimbursed for you. But you do have emergent and urgent care worldwide. And virtual care, of course, post-COVID, past few years, virtual care has become much more popular. You do have the ability to get virtual care from your doctors if need be. There was a question in the chat that specifically asked, if a provider leaves my network, what do I do? We are seeing this happen from time to time. And your plan, as we're going to discuss, has out-of-network benefits. So just because a provider leaves the network doesn't mean that you can't see them anymore. If a provider leaves our network, your plan provides you out-of-network benefits to see any provider who accepts Medicare. So we will reimburse that provider on an out-of-network basis based on the Medicare allowed amount for the service, just like we would do for an in-network provider. The provider, however, does not have an obligation to accept you. If the provider turns you away, if you go and you ask your doctor or the provider that you're trying to gain access, if they will accept your insurance and they say no, unfortunately, that's not something Highmark can override. If they're not participating with us any longer, we can't tell them to accept you. That is not particularly common in my experience, however. We have many members who are using out-of-network providers daily. Some of them don't even realize that they're seeing out-of-network providers, especially with Penn State coverage, because your benefits are so rich, their cost sharing isn't even changing when they go out of the network in a lot of cases. So just to address that question, if you have a provider who's telling you they may be leaving the network, please inquire with them directly if they will continue to see you, because your plan has out-of-network benefits. If the answer is no, they will not continue seeing you, we are happy to work with you to find other providers in your area who can assist you with that care. But again, I don't find that it's particularly common that a provider would say no, especially one that you have rapport with. Okay, so we're going to get into the benefits, and this is where we're going to talk about the changes. So bear with me here. We are adding a deductible of $200. This is for the medical plan only, the medical coverage. So eligible medical services will be subject to a $200 deductible starting in 2025. However, the member out-of-pocket maximum in 2024, traditionally for in and out of network combined services, was $750. We are bringing that down to $500. So $500 will be the most a member would pay for eligible and covered medical services, whether you are in or out of the network in 2025. So your total liability, if you go out of the network at all, is coming down $250. However, you do have a deductible to start the year of $200. That $200, though, I want to make sure everybody understands, that rolls into the $500. So it's not an additional $200. Your out-of-pocket maximum is still going to remain $500. It's just to start the year, you will be subject to a $200 deductible that needs to be satisfied. That goes directly into your out-of-pocket maximum of $500. And once that $500 is met, there will be no additional cost sharing for covered services in or out of the network for the remainder of the calendar year. So that will be a change. Again, that deductible, you may see a slightly larger bill at the beginning of the year because you have to satisfy the deductible before the plan starts paying. After that deductible is satisfied, you would pay your applicable co-pays or co-insurances where they apply until you meet that $500 out-of-pocket maximum. So I'm sure we might have questions, but I'm gonna move forward and we'll get to the questions at the end here. So on this slide, none of these benefits are changing. I tried to capture anything that's changing in red. Your primary care physician office visit is still $10. Again, that's in or out of the network. It's a passive plan design. So if your primary care physician is out of network, you still pay $10. We will still reimburse that provider. Specialist office visits are $20. Therapies are $20. Your inpatient hospital stay is $0. That is such a phenomenal benefit to have, having that security if you go into the hospital, to have no cost sharing at all. Same thing with skilled nursing facility care, no cost sharing for the member. Outpatient surgery, no cost sharing, or in or out of the network. Now, your emergency room copay is going up. It's $65 in 2024. It's going to be $100 in 2025. It should be noted, though, that that copay is waived if you are admitted within 3 days for the same reason for which you went to the emergency room. So happens commonly. If you go to the ER, they may admit you. If you are admitted, your copay is waived. And then you fall under your inpatient hospital stay, which again, we just discussed is $0. Urgent care is going to stay at $40. Ambulance is staying at $100. Diagnostic labs and images, that's, your MRIs, your x-rays, your blood work is covered in full, in or out of the network. Now, the only benefit that we have where your cost sharing could change if you go out of network is durable medical equipment. You would want to make sure that you stay in the network so that you can get your durable medical equipment covered in full. If you'd like to go out of network, that is going to go towards your out-of-pocket maximum of $500, but there is a 10% coinsurance for covered durable medical equipment if you use an out-of-network provider. Part B, prescription drugs. These are most commonly like your cancer drugs. The contrast materials that are used for imaging services fall under the Part B drugs. Those are covered in full for you, in or out of the network. Okay. So Amanda, what do you think? Do we want to take a break and answer a couple questions, or should I keep going and answer them all at the end?
I'll go ahead and continue.
Okay, we'll continue. Okay, so let's get into the drug coverage. More changes here with the drug coverage, but changes for the good. Changes for the good. So for years, we've been talking about the coverage gap or the donut hole. The coverage gap and the donut hole as a result of the Inflation Reduction Act is being removed. There are only going to be 3 stages of coverage for your prescription drugs, and 2 of them on the Penn State plan, you have no cost sharing in. So there is no deductible for prescription drugs. We talked about the medical deductible. That only applies to medical services. For the prescription drug coverage, you have no deductible as part of your plan. So you would skip that and go right into the initial coverage period. The initial coverage period is the stage where you're just paying your applicable copays, which we're going to review on the next slide. But as part of the Inflation Reduction Act, there has been a $2,000 threshold, an out-of-pocket maximum that's been placed on prescription drugs starting in 2025. So when that threshold is met, you move into the catastrophic coverage period where you would have $0 cost share for the remainder of the calendar year for covered drugs. Now, the $2,000 true out-of-pocket is not as true as it's named. It's not a dollar-for-dollar accumulation, and it actually benefits the member. So I'm going to have some examples of how that works on this very next slide, I guess. I thought I was a slide or 2 ahead of myself. So these are examples. These are just round number examples of how the accumulation may work for someone in 2025. Again, please don't take these numbers to be applicable to you and your situation necessarily. It's just meant to make round math here. If you are someone who takes, example A here is an individual who takes a medication that costs $1,000. These are costly medications. Not everyone is going to fall into this bucket. But if you are someone that takes an expensive medication, if it's $1,000, your copay, now under the Penn State plan, it's not going to be $30. The copays are a little different. But in this example, the member pays $30 when they go to the pharmacy. That's all the member's responsible for. They pay and they leave and they take their medications with them. However, the out-of-pocket accumulation is based on the standard Part D benefit design. And what that design outlines is 25% of the drug cost. So under this example, a $1,000 medication, 25% of that is $250. That is not what the member is paying. The member just pays their copay. But the accumulation in the background $250 goes towards that $2,000 threshold that we talked about. So the reason that I'm providing these examples is because if you are an individual who takes costly medications, who was paying their copays for the entire year, it is very possible that you may not have to pay your copays. You may reach the $2,000 threshold fairly quickly throughout the year. The part example B here is an even more costly medication, $5,000. So again, the member just goes and pays their applicable copay for that tier of that drug. This is just an example. But 25% of 5,000 is $1,250. So that is the amount that goes to the $2,000 threshold. So under this example, this member would only have to get 2 fills of their medication, and they would have met the $2,000 threshold. They don't have any copays for the remainder of the calendar year. So obviously not everyone takes medications that are this costly, but for the individuals that do, this $2,000 threshold is a huge, huge benefit enhancement in 2025. Okay, so diving into the copays here. With that $2,000 threshold, we do have, I'm sorry, I got distracted by one of the messages. With the $2,000 threshold, we do have some changes to the copay structure. The member out-of-pocket liability has gone down tremendously, so some of the copays have been bumped up a little bit. In 2025, you're still going to have $12 for your generics. This is a 31-day supply at a retail pharmacy. You have $35 copay for your preferred brands, $65 copay for your Tier 4 non-preferred brands, and your Tier 5 specialties are also going to be $65. If you want to get beyond a 31-day supply up to a 90-day supply at a retail a retail pharmacy, it's 3 times these copay amounts. However, if you use the mail order via Express Scripts, or if you use UHS Pharmacy for your 90-day supply, you have a much better cost sharing here. It's $24 for a 90-day supply of your generics, $40, which is, again, only $5 more than a 31-day supply at a retail pharmacy, $40 for your Tier 3 preferred brands, and $100 for your non-preferred brands. The reason it says not applicable for specialty is because specialty drugs are limited to a 31-day supply. That is a CMS mandate. We don't control that. If you want to use, for some reason, a different mail order pharmacy, you are going to be subject to the 3 times copay again of these retail copays here. So again, it makes a lot of sense to look in, if you're not already using them, Express Scripts or UHS Pharmacy for your medications to get the most bang for your buck. Okay, I am going to transition over to FitOn's presentation, but I do want to take time to answer any questions that are still outstanding before we move over to that. Are there specific questions that I'm sorry, I haven't been monitoring the chat, but
Tyler, it's Amanda. Would it help if I read some of the questions that may not have been like directly answered?
Sure, I can try to answer
Okay.
anything that you're seeing.
Okay, so I know this question, I feel like this question has popped up the last couple of years, and you did touch on it briefly, but maybe if you could revisit this question for those that may have the same question as this other attendee does. There are so many retiree advantage plans out there that don't require the $80 payment that the retirees pay to Penn State each month, and a lot of them have $0 copays, offers dental vision benefits, etc., as well as, you know, those allowances for food and over-the-counter medication. Why would someone choose the Penn State plan over one of these other plans?
Yeah, that's a great question. And you know, at the end of the day, not all plans are designed the same. Penn State's designing one plan for thousands and thousands of people. It is my opinion, as someone that works with Medicare Advantage plans every day, that this plan is wonderful. If I had loved ones that were eligible for this plan, I would tell them to never leave it. It's just too good of a deal. And again, yes, there are plans that are out there for $0, but there's just no way those plans have a $500 out-of-pocket maximum for their medical services. Now, if you're someone that would rather roll the dice and not pay the $80 and pay zero, and then risk having larger bills throughout the year, that's a personal decision that you'll have to make. On the flip side as well, with the prescription drug coverage, we were outlining, and this is pretty important actually. We were outlining the $2,000 true out-of-pocket maximum. Now that $2,000 is going to apply across the board to Part D, so it's not exclusive to Penn State's plan. However, Penn State, given that they have rich copay structure for their prescription drugs, they also have an expanded formulary for their prescription drugs. But given that they have the rich copays on those direct pay plans, on those individual plans, especially the ones that are zero and close to $0, you're going to see, starting in 2025 and beyond, that they are going to have to weaken the benefit structure of those Part D plans, wherein the member is probably going to be paying close to, if not the entirety of the 25% of that standard Part D benefit design. Remember, we talked about the accumulation behind the scenes. Penn State retirees have the luxury of paying their copays, and then the accumulation is always going to benefit them behind the scenes. It's going to be the higher of the copay or that 25%. On an individual plan, you're going to see a lot of those plans are starting to being designed where the copay and the cost structure for the drugs is 20 and 25%, sometimes even probably beyond that. And the reason for that is because they want to make sure that you are paying your full share, your full $2,000 each calendar year before you have no additional cost sharing for the remainder of the year. So these types of things that, might not pop out at you throughout the year, the strength of the benefits, the additional drugs that are covered in the formulary, the covered in full inpatient hospital stays, and the $500 out-of-pocket maximum on your medical services, your covered medical services, it just provides so much security, so much, for me, if it's a personal decision, but for me, you can't put a number, I don't think, on that, But again, if you're someone that would rather kind of roll the dice and maybe not pay the premium out of pocket each month, that's something you'll have to kind of consider individually. But for me, if my loved ones were eligible for this plan, I would encourage them to stay on it for sure.
Great, thank you. And then there were a couple of questions about the new Part D $2,000 cap. I just thought, for the good of the conversation, to ask this question out loud for everyone who's in attendance. Wanting to know which prescriptions specifically apply to that $2,000 cap. I believe an answer was provided that all prescriptions go towards that cap, just making sure that we're all on the same page and that is the correct answer.
That's correct. Yeah, all covered
Everything applies. Perfect.
Yeah, all covered prescription drugs are going to go towards that $2,000. So again, you're just paying your applicable tier, and you'll find this on the formulary. We're happy to make sure you know what your applicable copay is if you don't already know. But you pay your applicable copay for covered drugs just like you do now. And behind the scenes, that accumulation will occur. I neglected to mention as well that you get a monthly statement, a monthly summary, Part D summary from Express Scripts. And you'll want to make sure you keep an eye out for those as they come in. That's going to track your progress towards the $2,000. That's going to tell you what you've been getting filled and kind of give you those behind the scenes numbers that you're not going to have readily available to you necessarily at the pharmacy.
Perfect. Thank you so much for that additional explanation. Another great question that was asked, again, just for the sake of the entire group listening in today. There was a question about if you're outside of the United States and looking for virtual care, if it applies in that instance. So the answer to that question is no. If you are outside of the United States, the only coverage available to you would be emergency and urgency care. So just wanted to tackle that quickly. Another great question about services that may be exempt from the deductible. I did provide the response that your preventive services under that preventive schedule would still be a $0 cost share. Tyler, if you could just confirm my answer is accurate, I would love it.
Yes, sorry, I'm looking for, yeah.
Yeah, it was probably around 10:30, 39-ish, somewhere in that time range in the chat.
Yeah, I do think that your answer is accurate. I think Jeannie's on. I'm just trying to think, is there like a concise way, Jeannie, to maybe call out services that are not going to go towards the deductible? The supplemental benefits like hearing are not going to go towards the deductible. Is there
Right.
anything else that I'm forgetting?
I don't think so. I was trying to bring up their evidence of coverage to take a look because the evidence of coverage, of course, identifies what is included in the deductible, but I can't get into it right at this time. Figures.
Yeah, we can follow up, but I do think that Amanda, your answer is appropriate and accurate.
Okay. But there may be some additional items that do not apply to deductibles, such as the hearing
A
care.
couple of those
Double
supplemental
checking those.
benefits, yeah, that would not apply, and we'll define those. We'll make sure those are called out so we can make sure that that's forwarded back to the audience.
Wonderful. And then there was one question. I know Jeannie answered it in the chat for the individual that asked the question, but just for the sake again of everyone here, if you use emergency services and are admitted for less than 2 nights, are the expenses still covered? And the reason for the question was that this individual had learned that Medicare itself will not pay for less than 2 nights. So if you could maybe just expand on that for everyone in attendance,
And
you or
admittance,
Jeannie, whomever.
yeah, it's an admittance is an admittance. Some people are not admitted for more than 2 nights. I'll be honest with you, I have never heard that Medicare does not recognize an admittance of less than 2 days. That's news to me. But that does not apply to this plan. If you're admitted, you are admitted for however long that occurs for.
Right. If you're not admitted, then of course it's considered observation. So that's the difference there. But I agree with Tyler. I'm not aware that there's a rule with Medicare that they're saying you can't be admitted. It's up to the hospital.
Perfect. And then there is one final question that I will address for the sake of this group. There's the question, does University Health Services still not mail out of state? That is correct. They do not mail out of state. And that's based on, there are regulations regarding where they're allowed to mail to. So being that they're in Pennsylvania, so they do not mail out of state. Many apologies for that, but Express Scripts at that point would be your mail order resource.
There is an alternative. So if you are out of state, please, we'll get you in touch with Express Scripts if you'd like.
Okay.
I think we're going to move over to FitOn's presentation with Anna. And Anna, are you going to share your screen?
Yeah, Tyler, let me.
Okay, let me stop my share.
Thank you.
Sure.
All right. There we go. Making sure everybody can see my screen. Okay,
Yes,
great.
we can see it.
Awesome. Thank you so much. Thanks, Tyler. Hi, everyone. Thank you so much for allowing me to join and talk to you guys about FitOn today. The way I'll handle the presentation, we'll kind of get into
what FitOn is. We'll talk about our platform, talk about credits, our in-person network, digital, and then also explain how you can get started into using the benefit. FitOn Health is a revolutionizing health and fitness with integrated and engaging wellness care platform focused on driving behavior change. To start, we will get into what FitOn is so we can all know about it. So what is FitOn Health? We are a health and wellness platform built for today's modern senior while also catering to different senior needs as we do this by providing a whole health solution. In addition to our in-person network, which most people are already associated with the fitness benefit, we offer the widest variety of digital content. That includes workouts, meditation, meal planning, condition management courses, etc. You can absolutely think of this benefit as a one-stop shop for wellness care. It can be as simple as a member wants it to be, fun, motivating, interactive, however they're like to use the benefit. And your members will have access to several different ways of living a healthy life.
Excuse me, Anna, is there a way you can make your screen larger?
I'm not sure. I'm just sharing it. So this is all it allows me to do. It doesn't allow me to change the size of the presentation.
Try to share and see if it comes through differently on my end, if that helps.
Sure.
Let's see here. Okay. Does this look any better?
Yes.
Okay, so let's get back to where we were. Was this where we were? Okay.
Thanks, Tyler. Appreciate it.
Sure.
All right. All right. Now we're talking about our platform. So how does it work? And I mentioned our in-person network. This is where members have access to our nationwide network of over 14,000 fitness facilities, as well as getting access to at-home streaming options, all within the same account. Members can access their benefit on their desktop, mobile devices using browsers or on their app, or they can be completely offline and use the assistance of one of our customer service reps here at FitOn. Digging in a little bit more each month, members will receive an allowance of credits. These credits can be used towards different wellness experiences, as well as in-network. A few things to know about credits. These credits reset on the 1st of every month. They do not roll over, so they will expire at the end of the month if they are not used. If a member ends up using all of their subsidized allowance, they are able to purchase additional credits out of pocket if need be. Credits can be spent on monthly memberships, studio and virtual classes, day passes to a gym. Each experience has its own designated fitness cost, and that varies based on a few components. It could be the type of the experience, the location of the facility's pricing as the member selects those experiences, and designated costs will be deducted from the allotment based on what is chosen. Next slide, please. To give you guys an example of how you can use credits, credits are basically, you can think of them as tokens that can be used for memberships and class reservations, that sort of thing. Through Highmark, each member receives 32 credits per month, which is equivalent to $80 per month. So you can either choose to reserve a class, maybe it's a local yoga class for 6 credit. You can also purchase a membership, depending on, again, the facility's location and their pricing. It does vary, but as an example, you can use 20 credits per month to purchase a membership to attend the gym, unlimited visits, no limitations whatsoever. And as I mentioned, these credits do reset on the 1st of each month if there are any leftovers from the previous month. Next slide, please. To dive in a little bit more into our in-person network, our in-person network is basically our preferred network. Next slide, please. Sorry, Tyler. Thank you. So what does an in-person network look like? Our network spans nationwide and includes over 14,000 facilities. This number becomes outdated very quickly as we expand our network daily. You will see several of our notable brands we're working with right now on the left-hand side. Many of these are national partnerships where we have all locations in our network and offer users national memberships. We also work with thousands of local studios, gyms, and rec centers throughout the states. Members are not bound to the network in their area. They can use their benefit as they travel. So if you're working in your state and then you want a vacation, say in Florida or California or wherever, you can still use your memberships and go to those gyms that are available to you. Members can access our network through their desktop computer, on your mobile devices, your tablets, or you can, again, choose to do it completely offline by getting in contact to our customer support team at FitOn. Next slide, please. Now, we do recognize that we don't have every single facility in our network. That being said, it does not limit the member if a facility is not in our preferred network. We have our extended network that works beyond our preferred network. This is where if you are trying to go to a facility, you go and search for it, it's not in our preferred network, you can still search for it. It will bring it up, and all you will need to do is purchase their membership using our extended network credit card. This will be automatically generated for you, and you can use it towards membership. We can also, if this is something a member is unable to do on their own, our customer support team is able to assist the members directly and help them get the credit card to apply to those membership. Through this option, members don't need to worry about providing receipts for reimbursements either. And the credit card is $80 per month. So that's, again, it's equivalent to the 32 credits that is allotted to each member monthly. Next slide, please. Now, as I mentioned, even though we do have our extended network, we do ask that members, if at all possible, to nominate facilities that are not currently in our preferred network. Even though we do have over 14,000 facilities, and on average, we do add about 100 facilities, we do recognize that we don't have access to every single one of them. So nominating a studio will allow our network team to get in touch with those facilities and try to onboard them into our network. The process takes typically around 8 to 10 weeks. Which is, the outreach, negotiations, contracting, and onboarding. Please keep in mind that just because a studio or a facility is nominated does not automatically guarantee them being in our network. At the end of the day, the partners do have the freedom to either decide or reject joining our network. Next slide, please. Now that we've talked about the in-person aspect of our platform, we also have a digital platform. Our digital platform, if you could go to the next slide, please. FitOn Health is owned by FitOn, which allows us to tap into the digital content driven by our #1 fitness app on the App Store. All our exclusive in-app content is created in-house. Sorry, Taylor, if you could go 2 slides. There you go. Thank you. In-house and purposefully curated to give members the best experience possible. We create content specifically for our seniors members, including low impact style workouts, courses that include courses like Sleep 101, diabetes prevention, pain relief, and fall prevention. Again, the digital platform is available to all members. It does not cost any credits, and anyone can use it. Next slide, please. As for workouts, our digital experience meets our users where they want to use for their fitness journey. They can choose their experience type. They can number of preferred workouts per week, amount of time they want to work out, areas they want to target, and overall intensity. So we have quite a few ways that members can search for different workouts within our platform and be able to find what they need. Next slide, please. In addition to workouts, I briefly mentioned courses and programs. These are specific workouts that are between 4 to 12 weeks that are tailored to specific goals. And we have categories such as mindful meditation, condition management, beginners, mobility, and stretch. We are continuously adding new content to our platform. So as you get acquainted and you get familiarized with our platform, you will see that there will be a ton of new content added from time to time. Next slide, please. The other feature we have available to all members through our platform is our meal plans. This is a great way if any member is looking to have a meal plan, maybe look for different recipes, looking for healthier eating, articles, nutrition content, anything like that. We do have it that members have access to. The great thing about this feature is that once a member selects their meal planning, they can put every single recipe within a shopping list. And then the next time they go shopping, it just makes it so much easier to have to go buy ingredients rather than have to go recipe by recipe and having to jot down how many of each ingredient you need and be able to purchase it that way. So great feature, highly recommended. It's highly used by our population. And again, available to all members. Next slide, please. Now that we've talked about our in-person and digital, before any of this can happen, members need to register. So the way it works is members will need to go on 1/1 when we launch with Highmark. They will go to fitonhealth.com/register, enter an email address, choose a password, and then they will verify their eligibility. This is a very simple process, but we do recognize that not everyone is willing or is capable of doing things online. We do have an offline option that members, again, can reach out to our customer support team, and our support team will assist them through the entire registration process, help them through if they need to purchase memberships, reserve classes, or any questions at all regarding their memberships or account in general. Our support team will assist them. If you go to the next couple of slides, we do have the information on how members can reach out to that. Sorry, Tyler, one more slide. There we go. So as I mentioned, our support team is there to assist with anything from registration, inquiries, credits, purchasing memberships, reserving a class, and any other needs they may have. Our team is here to support your members, and we're here to do that. With resources, if you go to the next slide, please, we do have an email address and a designated phone number for Highmark members that you can reach out to. Our support team is here Monday through Friday, 8 a.m. to 9 p.m. Eastern time. And within those times, at any given time, if there are any questions, we're happy to help get members set up. I know that was a lot of information. I'm going to pause here and see if there are any questions. Let's see. Jan, I see you say, can we get the app through App Store on my phone? Yes, absolutely. Once you're registered, you can purchase the app on the App Store, and there's also an Android version of it. So either you have an iOS or Android, you can certainly purchase it on the App Store.
From Penn State Employee Benefits, just jumping on to help with some of these questions that I'm seeing. I'll go ahead and read them. But I'll be honest, this was a little bit of news to me this morning. So let's see if we can tackle some of these. We have a lot of folks who are saying they live in the State College area, which is where a huge portion of our employee population lives and where they retire to. So they're saying that they are looking for for participating gyms in this area and not finding any. So can you speak to what happens in the event that there aren't already available facilities? Like how do they go about finding someone who participates, and how to use your system with that?
Yes, of course. Like I mentioned, with our facilities, if a gym or a facility is not already within our preferred network, members do have the option of purchasing a membership through our extended network. It's just it's a very simple process, but again, you know, if a member has any questions, they can contact our customer support team, and they will walk him through step by step on exactly how they can go about using the facility or the membership.
A couple of more here. I know Tyler already addressed the question about why they were switching. So again, that was, I'm sorry. Okay, did you want to tackle that one just verbally for everyone?
Sorry, is that the question for me or internal?
Yeah, well, regardless, there were a lot of questions regarding why the switch. Tyler did address to everyone within the chat, but I'll go ahead and read that for you as well. Highmark is joining with FitOn to provide an enhanced benefit experience. I keep losing my chat because it keeps moving on me. As compared to Silver Sneakers, specifically allowing members to use non-participating gyms, whereas Silver Sneakers only worked with those participating gyms. So they're excited to partner with FitOn moving forward because it allows individuals that are not using those in-network gyms to go to other areas and still receive the discounts.
Yeah, and just to add to that, the actual Silver Sneakers network has been shrinking. So this is going to be a better option for all of you. I know there's a lot of questions and concerns that you won't be able to still go to the classes that you go to today at YMCA or other gyms, but you will be able to. I know there was one saying that I guess they thought that the whole 32 credit was going to be for like 1 or 2 classes for their whole week for that participating gym. And that's not the case. And I think Anna may be able to address that. Because I think, yeah.
Sorry,
Yeah, so with 32 credits, please keep in mind that you can purchase memberships to facilities and you get unlimited access to that facility. So it's not just 32 credits, I can go to 1 or 2 classes. It's 32 credits, and this is an example. It could be 20 credits. 32 credits, and you have unlimited monthly access. You can use as many classes. You can use the facility as many times as you want. There is no limitation on the number of days, the number of classes, anything like that. So you have free reign of how you want to use that membership.
And Highmark will be sending out information.
Oh, yeah. Yes, there is information. If you haven't already received it, it should be in your mailbox soon. But 32 credits, as Anna outlined, is equivalent to $80. So, you know, most gym memberships are not exceeding $80. I did pull up, Jill, I saw that you mentioned in the chat. I did actually pull up the website real quick, and I hope I'm navigating it correctly. But when I type in State College, just in the radius that I'm in, I'm getting 15 results. So I'm not sure if maybe it's just a technical issue when making the search, but just off the bat, when I type in more broadly State College, PA, there's 15 studio results.
Tyler, this is Jill. Sorry.
Hi.
Hey, can you possibly just read those out loud to this group?
I'm trying to get like a list. To be honest with you, Jill, it's just a map. Anna, I don't know if are you able to kind of share
I'm doing it as we speak.
Okay, great. But rest assured, there are participating facilities in the State College area. And again, it's very important to mention that one of the large enhancements with FitOn is the ability to use non-participating. So as Anna started her presentation off with, the network is expanding rapidly. The list of participating gyms is going to continue to increase throughout the year and as we partner with FitOn. But if you cannot if your gym or your desired fitness location does not participate with FitOn, there is a workaround to still be able to use them, and you will have funds loaded to a prepaid credit card to pay that facility, as Anna outlined.
And Jill, just to give you a few examples, I just pulled up State College, PA. There's East Coast Health and Fitness, YMCA of Center County, PYP Studios, Victory Sports and Fitness, North Club, Anytime Fitness, just to name a few.
Thank you. And we will make sure that we have, full information on the retiree webpage, so that all of these questions get addressed. So thank you for sending in your questions so that we make sure we get the website updated accordingly.
Yes, and we'll make sure that we get flyers and information for the website. And then again, Anna shared a number that is specific to Highmark with FitOn, as well as their website, if you have any questions or want to reach out to them personally.
Absolutely. And please keep in mind the benefit launches on 1/1. So if there is any questions, or if there is anything that, for example, if you try to register now, it will not allow you to, so please be patient. But you will get answers about the network, about anything that's related to an account that you will be able to use starting 1/1.
And one other thing,
Yes.
my understanding, and I hope I'm correct, my understanding is that individuals that are using Silver Sneakers currently, specifically within the last few months, if that gym is also participating with FitOn, they would be migrated into the FitOn system.
That is correct. That is
Transition.
correct.
So
We are, yes, absolutely. Currently, we're working to transfer all the existing memberships. We're already working with the Highmark team, and they have provided a list of memberships for those members to us, and we will be working to transfer them so that way, come 1/1, it will be a seamless transition, like nothing has changed. Members will be able to continue using the facility as they have been, either currently or in the past. So there should be no disruption to their usage of the facilities. Any other questions?
Yeah, there are a couple other questions in the chat here.
Got it. Let me look through it. How will we know when we're on FitOn? So starting 1/1, eligible members should have access to it. Members will receive communications from us in December, mid-December, prior to the Christmas holiday. So that way you guys are well aware of which memberships you currently have that are being transferred. You will also get to know about the benefit a little bit, and it will also include the phone number and any kind of contact information for members to be able to contact our support team directly. So communications will be sent out. If you haven't received it, it's because it's in the works, and it will be sent mid-December, like I said. Let me see. Can you explain what will we need to each month to maintain our transferred membership? Philip, nothing. Your membership will continue auto-renewing month by month unless you decide to cancel it. So once a membership has been transferred, as I mentioned, you can use it as you are using it now. And then if and when you decide to explore other options, maybe you just want to get a different membership, you can cancel your existing membership and purchase a membership elsewhere. So there is nothing you need to do right now, whether it's about the transfer of membership or the usage of it. It will happen automatically. Let me go.
Anna, did you name the local Y when you were? I think you did name a YMCA. There's a few questions about
Center County.
Yeah, so that's participating. There's a few questions in here about how many credits the Y will cost. The credits will depend on how much a membership costs at the Y, but they're participating. So
Yes. So that specific YMCA, it's 14 credits for their monthly membership. And keep in mind with the Ys are typically within a group. So if you have a membership to one Y, depending on the number of YMCAs within their group, you will have access to all of those. For the most part, they typically tend to be around the same number of credits. Again, it depends on the location. It may be a little bit higher, a little bit lower, but they're never, too different from one another. So keep in mind, 14 credits, you get 32 credits. You can get a Y membership. You can get another membership if you want to. You can do a membership. You can do a couple of classes. So you will have plenty of options to pick and choose from in order to use those credits.
Someone questioning if they could go to multiple facilities. So there's a great example of being able to go to the Y and having ample credits left over to actually go to a different facility as well, or take other classes at a different facility as well.
Yeah. Ron, I see your question about what's the difference to member between in-network and out-of-network exercise facilities. It's just the difference of how you get the membership. So our preferred in-network facilities, you can go on our website, either on the app or online, and you can see a list of them and you can purchase them online. You use your credits. If it's out of network, which falls under our extended network, which you can still purchase a membership, it will just be using your virtual credit card instead of using credits. That's literally the only difference. As far as benefits, it's the same way. You get the same membership. You can use the facility as many times as you want per month. So that's not changing. Is this per person on the Highmark plan? Lynn's asking. Yes, so we are working, I believe, I hope I understand the question correctly, but yes, this plan is through Highmark, and it is only for eligible members that Highmark sends to us. So it is just those individuals, and basically no dependents or spouses or anything like that.
The current Freedom Blue Penn State retirees will have access to FitOn starting 1/1/25.
Thank you. And yes, Sarah, it is 1/1/25. What else? Sorry, I'm trying to go through them. Please forgive me if I miss any of them.
How many credits do you receive from the plan per month? It's 32 monthly credits.
And Beth, I believe we answered your question regarding monthly membership, and then also being able to go to a yoga class or another class or facility or anything like that. So you do have an option for multiple memberships or class reservations depending on the number of credits you end up using.
Asked if spouses who are also on Freedom Blue do not have access to FitOn. Anyone who is a member of Freedom Blue, they're all individual contracts. It has nothing to do with spouses or retirees. If you are a Freedom Blue member, you have access to FitOn starting 1/1/25.
Katie, I see your question. I currently go to 3 gyms, so a membership won't cover my needs. It depends on those gym memberships. And again, depending on the number of credits each gym costs, you may be able to go to all 3, or you may be able to go to 2 of them. I'm not certain which gyms you're currently active in, but please note that if the 3 gym memberships exceeds the 32 credits or the $80 monthly allotment, you do have the option of adding a credit card to your file and just paying the difference out of pocket if you really need to. But again, when it comes to that, our support team can help you. They can tell you exactly the number of credits for each facility. And then at that point, you can make a decision on whether or not to keep 3 memberships or if you need to make any changes to it.
When you navigate the website, how would an individual find out how many credits each facility requires? Is it listed on the website?
Yes. So basically, when a member goes to when they log in, there is gonna be, I'm gonna try to share.
So this would be post login where they would see that
Correct.
information.
They
So
have
after
to, yes.
1/1/25, since people can't register just yet. So this information, it might not be out there right now when you're just looking more generally, but it will be available 1/1/25 when they register.
Absolutely. So
Okay.
once they register, they'll get full access to all of our network. And then once they find the facility, they click on it. It is going to tell them exactly the number of credits for a membership. And sometimes we have facilities that offer more than just membership. So if it's a membership, if it's a day pass, or if it's just classes, it will itemize every single option so members can see exactly what's available to them through that facility, and they can decide which option they would want to go with.
So, I think with Jill's permission, we'll try to answer maybe a couple more. Brenda, I'm trying to find your question in the chat. There's just so many, and I'm not able to locate it. If you want to try to maybe drop it back into your question back into the chat, we can try to answer it. I'm not seeing it though when I'm scrolling through.
Yeah, I'm not either. If you could resend it.
Yeah, this is Jill. I'll just, say again that all of this information with all of the details that are being asked in the chat will be posted on the retiree page of the Penn State Benefits website, so that all of the information, the details, will be out there for everyone to see.
Thank you for that. And no, the app is free. You do not need to purchase it. So you can just download it depending on what you're using.
Okay. Brenda, I still don't see that your question was popped back in here, so I think we are going to, oh, I'm sorry. The question from Brenda is if Penn State and Highmark ever run the numbers to see if covering dental and vision are feasible.
Do you want me to answer that one, Tyler?
Sure, if you could.
Sorry, this is Jill Musser. For those of you who don't know me, I'm the Senior Director of Benefits here at the university. And every single year, we deliberate a lot on plan design and contribution for both the active employees as well as retirees. We do run different numbers. I'll be honest with you, the plan changes that we've made to the Freedom Blue program for next year were necessary in order to keep everyone's monthly retiree contribution at the $80 mark. And so to add any type of dental, vision, or other what I'll call, bells and whistles, if you will, is going to increase the cost for everyone. The university spends currently around $35 million on Freedom Blue Premium in one calendar year alone. So there is significant investment being made. And I think the question that was asked earlier about why would I stay with the Penn State plan for the $80, and Tyler fielded that question very successfully because it is a very, very rich plan. And so Beth, or Brenda rather, to your point, we do look at this, but it would come at a cost, but it's certainly something that we'll take back and look at for 2026. So I hope that helps put some context around how we're trying to manage the plan and manage the costs, certainly for both our retirees and the university.
Okay, great. So I think if we haven't already, I think we probably, have we promoted the Matrix team as presenters? It looks like they are here. Matrix team, are you guys ready to roll?
Sure. Yep. Hello, Tyler. Thank you. Yeah, I think we've all been promoted and you have our content to share.
Yes, I'm going to start sharing that here.
Fantastic. And we're going to hear first from Stacy Antonucci, and she'll be followed by Danielle Mohar, both of whom are clinical managers within our organization.
Hi, everybody. I am Stacy Antonucci. I am a clinical manager here in Pennsylvania. Excuse me. I've been with Matrix for 12 and a half years, doing these visits in people's homes and loving every minute of it. So you can go to the next slide, please. The Highmark House Call program is something that we've been doing since we've been working with Highmark since I started here. It is a benefit to all Highmark members where we come in and spend up to an hour with you in your home with a licensed nurse practitioner. You're able to do this in the comfort of your home. And sometimes through a telehealth visit, if it's something that's necessary to do. There does need to be a video component to that, though. It can't just be a phone visit. We do need to see you on video. It is at no cost to you. It is a complement to your PCP visit. We do not take the place of your PCP or replace your annual wellness visit. We discuss and educate about your medical conditions, your medications, treatments. We do a physical exam. We can do some possible health screenings if necessary. We identify any challenges that aren't evident during a brief doctor's visit, because as you all know, doctors are booked for their entire day. They get 15 to 20 minutes to spend with every member, if that. And they have to stay on track to keep up with their day. Whereas we're given the time to spend with you and educate you if you need it on medications and conditions and your needs in the home. We talk about preventative medicine, vaccines that are due, things that are coming up as due, colonoscopies. And then we try to recommend that you talk to your doctor about those. We would not order anything. We don't change any of your medications. If we find something that we're concerned about, we always refer back to the primary care doctor. We can call them. We can have you follow up with them. But we do not make any changes to your health regime at all. We just make recommendations. Tyler, you can move to the next. So what can you expect from this visit? Typically, the nurse practitioner will give you a call, if not the night before, because especially that first visit, we start our visits at 8 o'clock in the morning. If you're an early bird and like that 8 o'clock in the morning visit, then we can get to you at 8 o'clock in the morning. So that first visit typically gets a call at night. Everybody else, you will at least get a call beforehand to let you know a 2-hour window. And then the day of, the nurse practitioner calls and says, hey, I'm on the way. We arrive, we have our medical badges with us. We make those known, and you should not ever have to ask somebody to see it. It should always be visible on their person. Then we do a lengthy health assessment. So we ask about your doctors, your specialists, healthcare power of attorneys, if you have advanced directives, living wills. We do family history, medication review, answer any of your questions and go through your health history in that way. Sometimes the health plan needs some screenings done. So we have the opportunity to do a few screenings in home if we are asked to by the health plan. We can do a A1C, so we can get a finger stick and check your A1C while we're there. We can leave a fit kit with you. Fit kit looks for blood in the stool, and it's something that we can leave with you, fill out all the paperwork for you so that all you have to do is get the specimen and ship it out. We can do a urine test. We can check the health of your kidneys with a finger stick and a urine test. And we can also do a check called a QuantiFlow test that checks the blood flow that goes down through your legs and into your feet. And this is done simply with a sensor that goes on your fingers, on middle finger on each hand and your big toe on each foot. You get a result right while we're there. Like I said, simply just a screening. And if something would come up as abnormal there, we would recommend that your primary care doctor order some additional screenings. But again, something that we would have you follow up with your primary care doctor for. Physical exam includes height, weight, blood pressure, listening to your heart and your lungs, taking a look at your eyes and in your mouth, checking the pulses on your feet. We check everybody's feet. Everybody's feet should be checked, not just diabetics. Again, we would talk to your primary care doctor if we find any abnormalities. If we listen to your heart and say, have you ever been told you have a heart murmur, and you say no, then we would make a call to your doctor and say, is this something that you know about and that you're monitoring, or is this something that you need to call and make an appointment for? We can place health care management referrals to Highmark. So if we come into the home and there's something that you need, say you have just been diagnosed with congestive heart failure or some new diagnosis that is going to be a chronic something that you're going to be dealing with, diabetes, and you need education, we can make health management referrals so that someone calls you and makes sure that you're on track, that you're following what you're supposed to, that you're going to need to, see the eye doctor twice a year. You're going to need specialists for this or that, and get you connected with those kind of things. So we can make those appropriate case management referrals if needed. If we would come into the home and see that people need help with access, that we can get them into the community, like the Area Agency on Aging, or food banks, those kind of things. We have access, transportation to and from your doctor's appointments. We have access in our tablets that we can look up local community resources and connect you with those things as well, to make sure that you have no needs that are going unmet. We want to keep you as healthy as possible and in your home for as long as possible. And then at the end of our visit, about 4 weeks after the visit, I would say, is a rough estimate, you will get a printout of our visit, and so will your primary care doctor. There should be no surprises in those printouts when you or your doctor get them. It should always be things that you've discussed with us at your visit, and that you know that we are either talking, like if I'm going to call your doctor, you're going to know, hey, your blood pressure is a little bit higher than I would expect it to. I'm going to let your doctor know, and let's just see if they want to see you or if they want you to, change a medication, something like that. We've gone into the home and sometimes people's blood pressures are a little lower because people don't communicate that they're seeing a cardiologist, a kidney doctor, and their PCP, and everybody's ordering the same medications. So we're able to make sure that those kind of things aren't going unnoticed, and that we don't have those kind of interactions with your medicine. All benefits that you would get with a visit in your home, and we would have the time to do that while we're in your home. Next slide, I think, is for Danielle. I think. Yes. Passing it over to Danielle. Thank you.
Thanks, Stacy. We're always so excited to be invited to this call and share, the benefits of Matrix. I know what some of you are thinking. I don't need this. I see my doctor. I see my specialist. Why do you have to come in and look at me? I've been here 13 years and I hear this all the time when I go to do visits. Or, you'll say, oh, I just said yes because they keep calling me. Well, we want you to know that this is a free benefit offered from your health plan, which is a wonderful health plan. So I always tell my patients, you can stay in your pajamas. We'll come, you're relaxed. You don't have to get in your car, especially today here in Pennsylvania, it's snowing. And I always tell my members when I come and visit you, I am a second pair of eyes, someone else to take a look at you that maybe you haven't seen. So you've been with your doctor for 5-10 years, you have that same person, you build that relationship, which is wonderful. And we're not trying to take that away. We're just trying to add at that second pair of eyes and make sure that you're getting everything that you need. There's times where I go in and I find something that, oh, my doctor or my provider didn't even check that. So let's talk about what we can do to help you with this. We can spend up to an hour as needed, answer your questions. Sometimes when you go to the doctor, they have the hand on the door ready to go to the next, patient because there's so many to see, where we have that time to spend with you, time to answer some questions, like Stacy said, and look up resources that might be needed for you. And if your plan offers it, there's sometimes a $20 gift card for completing the house call. Hey, that's lunch one day, right? You can go out to Subway or get a sandwich with somebody just for completing the visit. 9 times out of 10 after I'm done, most of the members will say, this was really nice. I'm so glad I did this. And I look forward to seeing you again next year. I just want to share a wow story. So next slide, Tyler. One of the things I love about working at Matrix is we often save lives. And one of the stories that I'd like to share is during a physical exam when the nurse practitioner came in, she heard an audible heart murmur. The member was not previously diagnosed and wasn't aware that they even had a heart murmur. They had some recent chest pain and shortness of breath with walking. So the nurse practitioner contacted 911 to have the member transported right away to the hospital for further evaluation. And a lot of you might say, oh, no, I'm not going anywhere. I'll be fine. Listen to the nurse practitioner. If he or she recommends something, they're doing that because they feel that something might be wrong and they want to help figure out the plan. So a few weeks later, the member's family called into Matrix and wanted to thank us for sending the nurse practitioner because they saved their mom's life. The member ended up having a blockage in the artery of the heart and needed a valve. And after a few weeks of hospital visits and some rehabilitation, they were doing much better. We hear stories like this all the time. I actually found a carotid bruit on a member that I listened in the neck. She did not want this visit. She was kind of grumpy when I got there and said, let's get this over with. And anyway, finished the visit and I found this blockage and I said, may I call your doctor? I'd like you to get this check. And she said, do whatever you need to do. I don't care. So anyway, I called and she followed up with her doctor. And, she called me a week later and said, I want to apologize. I'm so glad I said yes to this visit. I just said yes to get it over with, but you saved my life. I had 90% blockage in my neck. And not that we want to find something wrong, but it made me feel good that she entrusted and said yes to the visit. And I was able to get her help and support because it could have had a bad outcome. So I implore you, I encourage you, when Matrix calls, say yes to a visit. Let that nurse practitioner come in. If everything ends up being okay, great. You have that peace of mind from a second pair of eyes, letting you know, hey, I had a really good checkup and it was positive and I'd like to do this again next year. Maybe you didn't have a good experience with that nurse practitioner that came. That's okay. If someone calls for next year, say, you know what, I'd like to do this again, but maybe have a different nurse practitioner. Maybe you just didn't connect with that particular person. But I implore you, it's 1 hour out of your day once a year for a second pair of eyes to come and check on you and make sure that you're getting everything that you need. Okay, next slide, Tyler. So if you'd like to schedule a visit, a Highmark house call, the number here is on the screen. You should have access to this as well. Sometimes we do send flyers in the mail. So if you get that, look at that. Remember that nurse Danielle said on the call, give us a chance. Say yes to a visit. Try it. Like I said, it's free. There's no charge for this. You can sit in your pajamas and drink your coffee. If anything, like I said, it's just to go over and ask questions and reassure you that you're getting everything that you need. So there is a scheduling team that works 8 a.m. to 8 p.m. Monday through Friday. And then again on Saturday, you can even go online and schedule your own appointment with a nurse practitioner if there's one in your area. And we can do usually within a couple of days of you calling, or we can schedule a week or two out, or even the following month. So give us a call, give us a chance. We'll be glad to come and help you. And like I said, just give you that look over and make sure that you're getting everything that you need. I don't know if there's any questions in the chat for us, but we'd be happy to answer those. And we thank you so much for your time. You have such a wonderful plan here.
I would like to share just a story that I got just this week from one of my providers. Had a provider in the Western PA area who went to a member's home. Said she was talking with the member and his speech started to slur and there was some drool coming from the side of his mouth. And she asked if everything was okay. He said he felt fine. But she said as the visit went on, she could tell like his speech was just not the same. So even though he was against it, she asked if they could call the doctor. His son, because he kept saying that there's nothing wrong with him. So she got his son on the phone. And as they spoke to the son, he said, yeah, this doesn't sound like my dad. He doesn't sound the same in his speech. Something doesn't seem right. And so she got permission from the son to call 911. And she said by the time that the 911 emergency services got there, she had done a neuro check. His left side did seem a little bit weak to her. And he was talking to her and telling her stories, and she could not even understand what he was saying by the time the ambulance got there. And later that evening, his son had texted her and said that his dad had a stroke. But because of the quick response, he was able to receive treatment and the signs of the stroke were already reversing. Now, this is just one of those situations where our timing along with the visit just kind of meshed. And, the member really didn't have any idea that anything was going wrong with him. And it was just the nurse picking up on the speech and the little bit of drool that was coming out of his mouth that she initiated that quicker response and got him seen in time to stop some bad side effects. So those are just some of the stories that we get. And we're like, sometimes this is a routine. You see your doctor, everything's great. Your blood pressure's good. You're on track. You're going to the gym. You're doing all those things right. And every once in a while, we're in the right place at the right time and catch those kind of, emergencies that make us feel really good about being at the right place at the right time. So
yeah, and Tyler, I would just kind of wrap up by endorsing wholeheartedly the comments there from Stacy and Danielle. I'm not a clinical individual, right? I'm the client success director who manages the relationship between Matrix and Highmark. Great partners over many, many years. But I get to work side by side with these wonderful nurses, with Stacy and Danielle, their teams, And I hear these stories, I see these impact that they're having. And by and large, it's just wonderful feedback. It sounds like I've seen a few there in the chat where folks have said they've had a positive experience. As they indicated, this is not intended to replace PCP visits, not intended to replace wellness visits, but rather to supplement them, almost like a personal health coach, right? An opportunity to sit down, assess everything going on with regard to an individual's health, and better educating our members as to how they can take control of their health. They go into their PCP better informed about what questions they should be asking or could be asking, and they walk away feeling more confident about decisions that they have made in the past and the results that they're seeing as they have a positive impact on their health. So yeah, thank you for the opportunity to be here today to present. Danielle, Stacy, thank you for taking time out of your schedules to come and share this information. Tyler, any questions for us before we wrap?
Not seeing any in the chat, but thank you so much for coming. And yes, I mean, I am seeing some positive comments. Ron said that his experience with Matrix visits has been very positive. So we are getting some positive comments in the chat from individuals who have interfaced with Matrix. So thank you all for your time. I know we kind of ran past the allotted time there, so I hope we didn't keep you too long. But thank you so much for joining us and presenting today. So
thank you for the
happy to be here.
opportunity.
Yeah, great.
Thank you. Okay, so I think we'll try to get back and see if there are any questions left in the chat here. I do see that Jill dropped the Highmark customer service number in the chat for anyone who wants to, if you do have calls or questions, I'm sorry, and you'd like to give us a call, of course, with plan information, we're happy to assist. Let's see.
Tyler, there was one wanting to get back to drug prices, and oops, it moved again to the out-of-pocket costs that go toward that $2,000 cap.
Okay. Yeah, so let's see. We'll try to navigate back to, if I can, navigate back to the slides for a visual aid. But the accumulation towards the cap, the $2,000 is for prescription drugs only. It's not for your medical, so prescription drug costs. And the accumulation towards that $2,000 is based on the greater of the member's cost sharing or that standard Part D benefit, which is 25% of the total drug cost. So not all drugs are as expensive as the ones in the examples that I've provided here, but it's the greater of your copay, your allotted copay for the drug, or 25% of the drug cost goes towards that $2,000. So I hope that helps to answer. You will always get the benefit of the greater amount that will go towards that $2,000. So again, like I was saying before, individuals who are taking high cost medications, good chance that some of those individuals are going to meet that $2,000, probably without spending nearly that much out of their own pockets. And for the remainder of the calendar year, after reaching that $2,000 threshold, they would have no member cost sharing for their drugs for the remainder of the calendar year. Any other questions that I've missed? We had a full chat today, so.
I don't think so. I think those were it.
All right. And I know a lot of the questions were pertaining to FitOn. Just want to kind of reiterate, as Jill said, we are going to make sure that information is put onto the retiree website. As far as registering, keep in mind, you're not going to be able to register and gain access to the post-password website until the first of the year. But we will have resources. You will be receiving information in the mail that details the FitOn experience. So be patient with us. We'll get the information out there. And I think with that, Clif, I'll hand it back to you maybe to wrap up, or back to the Penn State HR team.
Thank you, Tyler.
Absolutely. Thank you for having me.
I'm sure there was a lot of good information received today. I was particularly interested in the FitOn presentation. So thank you, and I hope everybody did gain a lot of information today. As an aside, our next membership meeting is January 16th. We are currently working on the presenter for that meeting. We should have a commitment shortly, and we will pass that on to you. With that, I hope everybody has a happy Thanksgiving and happy holidays. So with that, we will close.